after your visit with your doctor, you're going to go home with a treatment plan. And what I've seen as a doctor is oftentimes women don't give themselves the grace to actually give that plan a true try. So what I would encourage you to do is to view it kind of like homework. You're going to take that treatment plan home and you're going to focus on that for you. You're going to take care of yourself for the first time. Women oftentimes, including myself, we put our families first, our work first, everything's first. But when you're going to try a new treatment plan with your doctor for menopause, you want it to work. You want to give it a fair chance. Well, if you're too stressed out and doing everything for everyone else, it may not give you the results you're looking for, or the stress from trying to tackle it all may mask the value of what you're trying. So, as I said, give yourself some grace. Give yourself a chance to let this work. Let your family know that you can't take on those extra tasks. You're not going to do the extra carpool. You're not driving up to get the poster board at 10 o'clock at night for the science fair. You're not going to do that extra grocery store run before work. You're going to actually schedule time for yourself, for the workout that you're going to do, the relaxation you're going to do. Give yourself a chance for that treatment plan to actually have a positive impact on your life. And then at the end of that time frame, when you're supposed to meet back with your doctor, you can give a true interpretation about your experience with this treatment plan so that the doctor can listen and say, okay, this is what we can do next. So give yourself a chance, do your homework, give that medication treatment plan a true try. And that, I think, gives you your best chance of having a good experience.